Acute Hydrophilic-Polymer Nephropathy and Acute Renal Failure by Andrea Pinzo Ledispa, Medical English, Dr. Moscoso. Definition, application in medicine, pros and cons, issue applied in Ecuador, conclusion. Definition of acute kidney failure. Acute kidney failure is the sudden loss of the kidney's ability to remove excess fluid and electrolytes as well as waste material from the blood.
Acute kidney injury, or AKI, when the kidney is not functioning at 100%, and that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF, but AKI is a broader term that also includes subtle decreases in kidney function. AKI can essentially be split into three types. Pre-renal AKI, meaning the cause of the kidney injury is before the kidneys. Post-renal AKI, meaning after the kidneys. Or atrarenal AKI, meaning within the kidneys. Watch the full video on osmosis.org.
Applications in medicine. The patient underwent renal transplantation in which the renal artery was implanted into a right external iliac artery. Between January and June 2013, her serum creatinine level increased progressively over a 5-month period. Pros. Polymer coat intervention devices are used frequently, and the diagnosis of polymer embolics is unlikely. Signs and volumes usually lodge in the arterioles of downstream organs.
I am Dr. Vishwanath, consultant nephrologist and HOD nephrology. I am working at Medical Hospital, Bangalore. Acute renal failure is what is also called as acute kidney injury, because it is called acute kidney injury because most often any injury will recover. So acute renal kidney failure also will recover. 99% of the time, acute renal failure means it is acute renal shutdown, where whatever has caused kidney failure, once it gets better, kidney will improve. The most common causes of acute kidney failure is in an ICU setting where blood pressures are low, they have some infection, where there may be significant. Once we treat it appropriately, it will get better. The other most common cause of acute kidney injury or significant blood loss. Somebody has road traffic accident, loses a lot of blood, or they have significant low blood pressure, which may lead to acute kidney failure. As I said, 90 to 99% of the time, acute renal failure, if it is picked up early, treated appropriately, can be definitely prevented. And most often, these individuals, the kidney function gets back to normal, what it was in the original state. Chronic kidney disease is the one where there is a relentless progression. It's a permanent kidney damage and more or less irreversible kidney damage. If we detect it early, definitely we can do something to prevent.
Cons. The associated events range from the non-detectable events to myocardial infarction, stroke, and death within days to months. Computed tomography and angiography revealed stenosis of the common iliac artery.
Hello, I am Dr. Ethan Ko, one of the nephrologists at the kidney specialist of Fredericksburg. Today I want to discuss the topic of acute kidney injury. So what causes kidneys to be injured or kidney function to drop? You may have heard different terms and descriptions such as acute kidney injury, acute renal failure, acute renal insufficiency. These all essentially mean the same thing. I also don't want to confuse you with what's known as chronic kidney disease. Simply put, chronic kidney disease is a long-term wear and tear, whereas acute kidney injury is an abrupt injury, such as spraining your ankle. For the purpose of this talk, we'll focus on acute kidney injury, or an abrupt, unexpected drop in kidney function. There are many causes of kidney injury. Let's refer to a picture and read from top to bottom. Things that decrease amount of blood delivered to your kidneys may cause stress to your kidneys. A good example of this is if you are dehydrated or have heart disease where the engine is not able to pump enough blood to your filter. Other examples include massive internal bleeding or a system-wide blood-borne infection, commonly referred as septic shock, both of which lowers blood pressure abruptly and dramatically. There are also various agents that are directly toxic to kidneys, such as antibiotics, chemotherapy, NSAIDs, such as ibuprofen, and contrast or dye material we use on imaging, such as CAT scans and cardiac catheterization. In some instances, a broken mechanism of your own body's immune system, such as lupus, can attack the kidneys and injure them. So moving lower into the tract, a mechanical blockage in our urinary system that obstructs flow, such as an enlarged prostate or a kidney stone, could cause backflow into your kidneys and cause damage. A good example of this is when you clamp down on your garden hose that is turned on. The result, as you can imagine, is a high pressure backflow causing damage to your main plumbing system or your kidneys. These all cause stress and damage to your kidneys, and regardless of the injury, can be reflected in your lab work with rising creatinine levels or a decline in estimated GFR levels. In my next video, we will discuss treatment options of AKI. Thank you for taking the time to watch this video.
Issue applied in Ecuador. This renal lesion may be induced by hydrophilic-polymer emboli. We speculate that the stent in the iliac artery was the most likely source of the emboli, in light of the anatomic proximity to the anastomosis.
Acute kidney injury is an acute condition that happens rapidly. It causes a loss of renal function. It affects millions of Americans, more than a million Americans a year. It causes a doubling of hospital mortality and hospital length of stay. It costs millions, in fact, billions of dollars in cost to care for. And it causes long-term disability in terms of kidney disease, for dialysis, and conditions like increased risk for cardiovascular disease. It's very difficult to diagnose, which is part of the problem for treatment. Early on, there's no symptoms. It's a silent killer. Later, it's diagnosed by changes in function, which are manifest by changes in creatinine or urine output. But by then, there's often already a loss of kidney tissue. In terms of treatment, right now, treatment is largely supportive, although the hope is that new emerging therapies will be useful in the future. Supportive therapy, though, is important because there are the two most common causes. Sepsis and treated with antibiotics and source control, and we can identify nephrotoxic medications and discontinue those and choose better alternatives. The Center for Critical Care Nephrology here in Pittsburgh is devoted toward bringing together scientists and clinicians from a wide range of disciplines to address this problem of acute kidney injury and related conditions. But acute kidney injury in particular is such a difficult problem that really requires a multifaceted approach. Some of our major accomplishments have been to actually initiate in the hospital system an alert for acute kidney injury. It's in the medical record system. It goes back and finds baseline serum creatinine, which measure renal function, and looks at the change between that measure and a current measure, and tells people that that change has occurred, and gives them a leg up in terms of noticing that this is a problem. Our scientists have led the field in terms of developing studies which have demonstrated the validity of a new biomarker panel for detection of acute kidney injury, risk assessment of acute kidney injury, which recently FDA approved. I think the most important thing physicians need to understand, and when I say physicians, I mean not just nephrologists and intensivists, but physicians in different disciplines. Much of acute kidney injury is first seen by family practitioners, emergency room doctors, orthopedic surgeons, and so by the time intensive care doctors and nephrologists see them, it's often too late. So I think it's very important for physicians to understand that this is a common problem, that it causes severe disability as well as short-term illness and death.
Conclusion. In conclusion, the current case highlights what we consider to be an under-recognized iatrogenic complication. Emboldened foreign material may be present in patients who have undergone recent implantations and intravascular device with hydrophilic coating.
Acute kidney injury, or AKI, is when the kidney is not functioning at 100%. And that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF. Watch the full video on osmosis.org.